here the vertebral column was removed, and what you can see is the posterior wall of the pharynx, right? Which was cut to enter into the end of pharynx, yeah? And what we can see here are the three parts of the endopharynx. The nasopharynx here, oropharynx here, laryngopharynx here. You understand? This, the laryngopharynx, the orifice, this orifice, is the edidus or the inlet of the larynx, yeah? Here was cut also the larynx to see the inside aspect of the larynx. So this is the larynx and the esophagus. If you close the larynx, this part is actually the esophagus. So from here continues the esophagus, right? Okay, what we can say. Let's describe the parts. The first part, nasopharynx. When you describe it, you have to know that it has the four walls. Yeah, the anterior wall actually doesn't exist because you have the orifice to the nasal cavities. Those orifices are called quanae, right? Quanae. The nasopharynx also has a roof. The roof is at the level of the base of the skull. What you have to know about that part is that the periosteum of the base of the skull in this portion, in this part, is quite thick, and you have sometimes there it can grow some tumors. Well, vascular, that is, tumors. Okay, the posterior wall doesn't have so many features on it, but the lateral wall does. And this is the lateral wall, where we can find two orifices of the auditory tube. The auditory tube is a tube that will connect the pharynx, the nasopharynx actually, with the middle ear, to make the same pressure in the middle ear and the external ear. You understand? This orifice looks like a triangle. It will have a base. The base is called the levator elevation because underneath it you have a levator muscle, the levator of the soft palate. Yeah? This is the base of the orifice. Anterior to this orifice, which I told you it looks like a triangle, you have a fold. This is called salpingo-palate fold because it will continue with the soft palate, right? So salpingo-palate fold.
Which one? Sorry.
This is the fold. Salpingo-palate fold. The posterior border of the orifice, it's formed by a more hard part, which is actually a cartilage of the tube, which is called, so the border is called the tubal elevation. Tubal elevation. Tubal from the tuba, yeah, or the tube, the auditory tube. But because it's a cartilage, it is called an elevation. From the tubal elevation down, you have a fold of the mucosa called salpingopharyngeal fold. So, if you want to say this orifice looks like a triangle, the base is formed by the levator elevation, the anterior border is formed by the salpingopalate fold, the posterior border is formed by the tubal elevation, and the salpingopharyngeal fold. On the same wall of the nasopharynx, posterior to the auditory tube, you have a recess of the pharynx called the pharyngeal recess, or Rosenmüller fossa. Rosenmüller fossa. Yeah? Which is this thing. Yeah? This is the wall and this is the recess.
Which fossa it's called?
Rosenmüller. Okay? Oropharynx. What you can see is the orifice to the oral cavity, where you can see the soft palate with the uvula and the base of the tongue. This is the tongue. More inferior, you have the limit between the oropharynx and the laryngopharynx with the epiglottis. Between the epiglottis and tongue, you have three folds called the glossoepiglottic folds. Two are laterals and one is median. Between them you have two fossas called the valleculae. Okay? This is important, I told the other guys, in the intubation of the patients. Yeah? You have to put a tube into the larynx. In order to do that, you will use a device called laryngoscope, which will enter the oral cavity and will push down and anterior the base of the tongue in this area, so the folds will tract the epiglottis also anterior and open the adytus of the larynx, and then you'll see the vocal cords. Yeah, and between the vocal cords you will put the tube of the intubation. And the laryngopharynx with the epiglottis and the adytus. This all more about them you will learn when we'll do the larynx and the oral cavity. Okay, guys?
So this is the nasal pharyngeal region.
No. It's not a region, it's the nasopharynx. It's called
Nasopharynx.
nasopharynx.
Okay. So what is these two?
Oropharynx, oropharynx, this part.
Okay.
Laryngopharynx.
And this thing?
This is the larynx.
The larynx.
Questions?
You see, it's the mouth, you know.
What?
You can see it. It's the mouth and here's the nose orientation.
Oh.
Yeah?
This is sagittal
Yeah.
section through the head. Yeah, the oral cavities and the tongue cut in two. Nasal cavity, nasopharynx,
Oh,
nasopharynx.
yes.
Soft palate with the uvula.
Okay.
We have, it's possible to have this kind of head in the exam.
Yep. And this one too.
It's like, are we supposed to find any nerves over there? Like on
No.